A single microscopic cell dividing out of turn might not look like a threat, but left unchecked, that tiny error can systematically shut down the entire human body. But the primary lump itself is rarely what kills you. The lethal blow usually strikes in a completely different part of the body. Cancer is a localized mass of abnormal cells growing without control. Initially, it sits passively without causing symptoms, but the danger begins when it pushes outward, invading surrounding tissue and rewiring the local blood supply to feed its own growth. A localized lump of tissue doesn't inherently end a life. The threat comes from how that expanding mass systematically dismantles the physical structures you rely on to survive. In the lungs, an expanding tumor can physically compress your main airways. It infiltrates the tiny air sacs where oxygen exchange happens and chokes off your ability to breathe, leading directly to respiratory failure. If a mass grows in the liver, it can pinch your bile ducts shut or entirely replace healthy, functioning tissue. With the liver offline, toxins quickly build up in the bloodstream, triggering deep jaundice and eventual organ failure. Inside the skull, there is zero extra room. As a brain tumor expands against the rigid bone, it forces healthy brain tissue downward into the brainstem, a process known as brain herniation. This rising pressure triggers seizures and eventually shuts down the basic neurological signals that tell your heart to beat. Look at this slide of healthy bone marrow. Notice the high volume of normal red blood cells and the central white blood cell. Your marrow functions as a factory, constantly producing these life-saving oxygen carriers and immune defenders. This chart shows what happens when leukemia takes over that factory. As useless, immature cancer cells, called blast cells, multiply, they physically crowd out the healthy marrow space. The production of normal red and white blood cells crashes towards zero. In all of these cases, the human body operates as a mechanical engine, and the growing tumor physically jams the critical gears required to keep it running. But what happens if the original mass is located in an area with plenty of room, far away from any vital organs? Metastasis occurs when cancer spreads from its origin. Cells break loose, tear through tissue, and spill into the bloodstream and lymphatic channels. A surviving fraction take root in distant organs, like the brain, liver, or bones, establishing new tumors. This migration turns a singular, localized physical threat into a simultaneous, multi-organ siege. Yet even with widespread tumors, the direct cause of death is often a secondary complication. The cancer disables your body's innate security systems, allowing minor outside infections to deliver the fatal blow. It starts by destroying your physical barriers. Tumors like squamous cell carcinomas can tear through the epidermis, creating deep necrotic ulcers on the skin. Other masses might obstruct the colon. Both scenarios provide outside bacteria with a direct, unhindered path straight into the bloodstream. Once those bacteria enter, they face almost no resistance. Because tumors and chemotherapy suppress the bone marrow, patients develop neutropenia, a severe drop in white blood cells. The few remaining immune strenders drift aimlessly, ignoring the multiplying bacteria, which leads to a massive system-wide infection called sepsis. By dismantling your physical walls and depleting your immune reserves, the cancer weaponizes your own biological environment, turning everyday microbes into lethal threats. The disease also manipulates the blood itself. Many tumors release chemicals that trigger a hypercoagulable state, causing your blood to clot rapidly. This forms sterile, non-bacterial clots in your heart valves that can suddenly break loose, travel to the brain, and trigger a massive stroke. Other times, the vascular threat is purely physical. A massive tumor in the chest can press directly against the superior vena cava, completely blocking the major vein that returns blood from the brain. The backup of fluid leads to severe swelling, respiratory distress, and cardiac arrest. By chemically thickening the blood and physically crushing major veins, the tumor transforms your circulatory system from a vital delivery network into a catastrophic hazard. Even if the organs hold up, the disease executes a final attack called cachexia. The tumor aggressively hijacks your metabolism, burning through your body's energy reserves and causing severe, unintentional weight loss and muscle wasting. This total metabolic drain strips the body of its strength until the patient is completely immobile. The muscles driving the lungs and heart become too weak to pump, directly causing up to 20% of all cancer deaths through respiratory or cardiac failure. Cancer rarely kills through one predictable method. It's a complex disruption of your precise biological balance, executing distinct attacks across multiple internal systems. By mapping these exact pathways of collapse, from immune suppression to metabolic theft, modern medicine is developing targeted therapies, like checkpoint inhibitors, to intercept the damage before it becomes fatal. Treating this disease requires shrinking the original tumor, while aggressively defending the body's interconnected systems from being hijacked from the inside out.